Now, joining me to unpack more on this and update what is going on in Zimbabwe is Batanai Matsika, the head of research at Morgan & Co. So, Batanai, you mentioned in your note earlier something about the new poor in Zimbabwe. Exactly how big is the problem there?
Okay, so as you rightly put, I think from the estimates that we are seeing from the World Bank, I think SSA is actually hard hit from an economic standpoint. Yes, from a health perspective, the virus hasn't really, affected a significant number. But what we're seeing really is issues around dependence, especially with especially unbuzzed economies. So you find that an economy like Zimbabwe depends a lot, especially on things such as remittances. I think another estimate that has been put out is that roughly a decline of 23% is expected to happen now. So really, for Zimbabwe, we're basically looking at households really that depend a lot from diaspora remittances. So within Zimbabwe, of course, there's been a lot of focus around the existing poor. So these are basically those that are located in rural areas that depend on subsistence farming. However, we're seeing a new poor, basically those that are based in urban areas and are also involved in informal activity. So really, that's quite significant, and that's a major risk simply because some of these social safety nets really don't cater for the existing poor, for the new poor actually. So really, that's a new concern that we're seeing coming up.
And in terms of of how it's going to affect the economy on the ground, there's going to be a huge knock-on effect. And bearing in mind, most economies in sub-Saharan Africa, including yours and this one in South Africa, weren't in great shape before this COVID-19 outbreak.
Yeah, so for Zimbabwe, we're basically looking at a double blow because we're basically coming from another shock as well. So you find that the impact of the drought and cyclone was quite significant, especially in terms of GDP contraction. So really going forward, we expect trade flows to actually remain quite depressed, diaspora remittances to come down, and limited economic activity. But what we're seeing, really, given the issues around poverty levels, we're seeing that disposable incomes are coming under significant pressure. So really, that speaks to demand levels and also issues around viability for companies going forward. I think in terms of estimates, we had put GDP contraction at roughly around 12% for 2020. But really, we see that there's a lot of risk. So basically, we are going to be reviewing that in 2020 as well.
And lastly, and very briefly, just looking at the worldwide figures today, it shows that Zimbabwe's only got 37 cases, of which 12 people have recovered. How serious do you think, and how widespread is the testing system there in Zimbabwe? I mean, or are these reflect truly what's happening?
So the limited financial reserves within the broader economy actually mean that the health system are not adequately, capitalized in terms of financial resources. So you find that a key constraint is really around the testing aspect. So we haven't seen a lot of tests happening simply because of the resources that are quite limited. So basically, the 37, the number that you have there, is not really reflective of what's on the ground. So it's really an unknown, especially if you then compare with regional peers. I think South Africa and countries such as Namibia. It really shows you that the numbers really don't actually make sense from a practical perspective. So our take really is that the virus is quite severe, and the numbers really don't show what's actually happening on the ground.
Well, thank you very much indeed. That was Batanai Matsika coming to us live from Harare there, the head of research at Morgan.